Good afternoon, everyone. This upcoming segment is a recording that is a part of the Building Communicable Disease Prevention and Control and Emergency Preparedness in Curriculum, an online session that's offered through the Canadian Nurse Educator Institute in partnership with the Canadian Association Schools of Nursing, CASN. This video demonstrates an example of a phone interview by a public health nurse for case and contact management of the COVID-19 virus. Keep in mind that the new knowledge and information about COVID-19 continues to emerge and evolve over time, and the content in this presentation may not be reflective of the current context, depending on when you are viewing this video. But hopefully you will still find the information related to nursing assessment, education, and interviewing skills helpful. So we will be role-playing an interview to show you how case and contact management is completed. We will have the client, the nurse, as well as the client's sister involved in this interview. Client's name is Alice Wonderland, and before you on the slide is her date of birth. The testing date for her COVID-19 was on Sunday, June 22nd, and the date and time of this phone interaction is actually occurring on Tuesday, June 24th. Hello, my name is Susan, and I'm a public health nurse from the Happy Valley Public Health Unit. I'm calling to speak with Alice.
Hi, I'm her sister. Is this about her COVID test? What was her result?
Sorry, I'm not able to provide this information to you. I would be happy to speak with Alice about her own personal health information. Is she available?
Yes, hold on.
Hello.
Hi there, my name is Susan, and I'm a public health nurse from the Happy Valley Public Health Unit. Am I speaking with Alice?
Yes, you are.
I'd like to confirm that I'm speaking with the right person. Can you please confirm your last name, your date of birth, and your address with me?
How do I know that this is not a scam? Why should I believe you and tell you my information?
I understand your concerns in providing your personal information to me. How about I provide you with the Happy Valley Public Health Unit phone number and my extension for you to call me back. Or you could also look my name up on the College of Nurses of Ontario Find a Nurse website.
Well, okay, it'll be fine. My last name is Wonderland. My date of birth is June 20th, 1964, and I live at 1951 Walt Disney Crescent in Toronto, Ontario.
Can you also provide your postal code?
Sure. It's L5M1T6.
Thank you, Alice. So I'm calling today about your results for your COVID-19 test. Before I continue, I would like to ensure you are aware that we document all of our calls on a confidential health record that may be shared with other health department staff within your circle of care, and only with others outside the health department if required by legislation or with your consent. Did you have any questions or concerns about our privacy policy?
No, I'm okay with all of that. I've got no concerns.
That's great. Thank you. As I was saying, your results have come in and you have tested positive for COVID-19. How are you feeling about this?
Wow, seriously? I am really surprised because I've been doing everything from washing my hands a lot, disinfecting surfaces and electronics at home, staying away from crowds in public places, and social distancing from others. I thought it was just a common cough, but my sister told me to go get tested just to be sure.
I'm sorry to be the one sharing this news with you, but it is important for you to know others just like yourself have been surprised by their results. And it is evident to me that you have a lot of information and have been doing your best to keep yourself safe and to prevent the spread of viruses. As you are likely aware, COVID-19 is a reportable disease to public health, and our role is to follow up with individuals diagnosed with COVID-19. So the purpose of my phone call today is to provide you with information, answer your questions and concerns, and advise you of next steps. I will need to gather more information about your illness and your activities after you became ill to help us understand, um, to help our understanding of the virus and to help stop the spread.
Okay, sure.
So tell me what you already know about COVID-19.
Well, I know it's a virus. I don't know anybody personally that's had it, but I hear on the news that people are dying of it.
You are correct that COVID-19 is a virus that may cause illnesses, and it ranges from mild symptoms such as a common cold to more severe diseases such as pneumonia or kidney failure. The risk of severe disease or death is higher for people with a weakened immune system. Common signs and symptoms of COVID-19 include a fever higher than 37.8 degrees Celsius, and or respiratory symptoms such as cough, shortness of breath, or breathing difficulties. Other symptoms of COVID-19 can include sore throat, difficulty swallowing, loss of taste and or smell, headaches, unexplained fatigue, chills, vomiting, nausea, diarrhea, abdominal pain, runny nose, or nasal congestion. The virus is primarily spread from person to person through droplets and direct contact. Unfortunately, there is no treatment or vaccine available for COVID-19 at this time, but most people recover in the home with rest, drinking plenty of fluids, eating nutritious food, and managing their symptoms. Do you have any questions at this time?
Not right now.
Okay, I will continue with a few questions to learn more about the duration of your symptoms you're experiencing, or if you've experienced any symptoms in the recent past. Alice, when did your symptoms start?
They started last week on the 18th. No, wait, the 19th.
Okay, just to clarify, this is Friday, June the 19th you are referring to?
Yes, the 19th.
Can you tell me more about your symptoms that began last Friday?
Well, it started as a cough, some sneezing, and I guess I had a bit of a headache.
Was it a dry or productive cough?
It was a dry cough.
And have these symptoms resolved?
I don't have a headache anymore, and I'm not sneezing anymore. Those symptoms got better the next day on Saturday, but the cough is not getting any better, and I still have it today. In fact, the cough feels worse, especially when I go upstairs.
Well, I am glad to hear that some of your symptoms are getting better. Besides the cough for today, what other symptoms are you experiencing? Do you have a fever, any breathing difficulties, or chest pain?
No, no other symptoms except the cough.
I'm sorry, this talking probably isn't helping your cough. Would you like to go get some water?
No, that's okay. I have some water here.
Okay, please take your time in responding. Take breaks if needed to reduce your coughing. May I ask how you are currently managing your cough?
Well, I've been having a drink of water so far when I'm coughing, but I'm thinking of maybe trying to get some over-the-counter type of cough syrup.
I see. I do encourage you to rest. Continue to drink plenty of fluids. You may want to try a humidifier or a hot shower to see if that might help. And if you do have questions about medications, your pharmacist or your healthcare provider may be able to help you over the phone.
Okay, that sounds good. I'll try that.
Could I ask if you have any pre-existing medical conditions, such as diabetes, asthma?
No, I seem to be in good health for the most part.
Alice, I have a few questions about your activities to assess for any potential exposures and how you may have acquired COVID-19. Have you traveled outside of Canada or the province in the last 14 days?
No, I haven't traveled recently, but I sure could use a vacation.
Myself included. Or have you had close contact with a person with acute respiratory symptoms or is a confirmed or probable person with COVID-19?
I don't actually remember anyone around me being sick.
Thank you. Could you share with me any individuals you had interactions with, both within and outside of your home, including if you have been to work 48 hours prior to when your first symptoms appeared? So this means the time period I am interested in would be from Wednesday, June 17th up to today. Please think about any activities, such as dining at a restaurant, going to work, visiting a clinic or health service, also how you traveled from one place to the next.
Well, on Wednesday the 17th, I was at work. I work in an office as an IT specialist. I went to the grocery store with a co-worker together to pick up some milk and bread and refund an item at the customer service desk. Then on Thursday the 18th, I was at work again. Then I went to visit the walk-in clinic after work that day. And that's when the doctor gave me the referral for the COVID-19 test. From Friday the 19th to today, I've just been at home, besides going to the hospital on the 22nd for my test. At home, I live with my sister. I walk to work, the grocery store, the walk-in clinic. I took a taxi to go to the hospital for my COVID-19 test.
Thank you for this information. Alice, can you please provide the names and phone numbers for your supervisor or manager, your coworker you went to the grocery store with, the grocery store's name, the walk-in clinic, and taxi company if you have them, as well as your sister's contact information? So we're just gonna stop the role play for a moment, and this slide outlines just the complexities of contact tracing and the information we do gather from our clients. So for example, some activity prompts we may ask include about work, school, their travel, did they drive in a private vehicle by themselves? Were there any passengers? Did they take public transit? Was it a taxi or a ride share? Any visitors in the home, volunteer activities, daycare, religious activities, social activities, including dining at a restaurant or going shopping, any visits to a walk-in clinic or hospital, or any contact with ill persons. For work, we would, as I've asked Alice for the contact information for her manager or supervisor, we would contact the manager or supervisor to ask questions, to learn more about the layout of the workplace, the type of contacts this employee has or customers, if there's the use of PPE within the office and the requirements for that, if physical distancing practices were implemented and enforced consistently, where and with whom lunch was eaten or breaks taken, and also meetings, any formal or informal meetings, are they done in person or virtually? Because that will also help us determine whether or not somebody may be at risk of catching COVID-19. In terms of risk assessments, this list here speaks to some of the factors that would influence whether somebody would be at higher risk of potentially catching COVID-19, and we asked for details related to each one. So for example, somebody would have a higher risk if a person was not physical distancing from the person who has tested positive for COVID-19. So they've been interacting within less than 2 meters of each other. Also, the types of interactions, it's higher risk if there's food sharing, kissing, handshakes, hugging involved. The duration, the longer the time, then the higher the risk. The susceptibility, and this would include if the contact is immunocompromised or may have other existing medical conditions, is a senior or is not wearing PPE, then their risk would be higher. And also environmental factors, the risk is higher if it was within a closed environment inside a room versus being outdoors where there's better ventilation. And finally, the severity of the symptoms during that interaction. So somebody that has COVID-19 and is asymptomatic, it's less likely, the risk is less for the contact to pick up the virus, whereas if the case is coughing and sneezing, then of course the risk is higher in those situations. So we're going to go back into the interview and we're going to continue on. So based on my assessment of each interaction, I may be reaching out to the contacts you have named as they have the right to be informed they have been exposed to someone with COVID-19, their level of risk, and receive appropriate health advice. I will not be disclosing your name as this is confidential information. However, they may be able to identify themselves that I am referring to yourself, Alice, as a person with COVID-19, but know that I will take all measures to protect your confidentiality unless it is absolutely necessary, as determined in consultation with my manager, that I have to share your name to gather more specific and relevant details. I do recommend that you notify your workplace supervisor or manager about your circumstances and to let him or her know to anticipate a phone call from the health department.
Okay, that should be no problem. I can let my supervisor know. And I'm going to tell my family and my coworker as well.
Thank you, Alice. I'm also serving you a class order issued under the authority of the Health Protection and Promotion Act because you have tested positive for COVID-19. This means that you are required to self-isolate immediately. That is to stay at home, not have visitors, and you cannot leave under any circumstance except to seek medical care. You should not go to work, school, or use public transportation or go to other public places such as malls or restaurants. Individuals who are required to self-isolate as identified under this order and who do not do so can be charged and fined up to $5,000 per day. You can reduce exposure to your family by staying home and limiting time spent with others, such as having a separate bedroom, sleeping arrangement, and a separate bathroom if possible, as everyone in your home would have to be on self-isolation starting today. Wear a mask when unable to stay at least 6 feet or 2 meters away from others. Keep windows open when possible. Do not share items, wash your hands frequently, or use alcohol-based hand sanitizer. Good coughing and sneezing etiquette. Refrain from touching your face with unwashed hands. Disinfect frequently touched objects and regularly used surfaces. If you live in an apartment, you may not leave your unit because you must avoid the common areas of the building where others might be, such as the elevator. You may go on a private balcony or enclosed yard where you can avoid close contact with others. Avoid close contact with people who are ill. Make arrangements to remain at home, so discuss with your employer and ensure that you have an adequate supply of groceries and other necessities. What is your level of confidence in being able to remain on home isolation and follow public health recommendations?
Well, I've already been doing most of those things that you listed. I do have some face masks, and I don't have a problem staying home and following your advice.
That is excellent. Are you able to self-isolate in your home, your own bedroom and bathroom?
Yes, I have my own bedroom and bathroom.
That's great. And who might be able to help with getting groceries and necessities that is not living with you?
Yes, I think one of my aunts or uncles could help with that.
I'm so glad to hear you do have supports available. Please note that there are services as well to help deliver groceries to your home if needed. So Alice, in terms of a plan moving forward, either myself or another nurse that I work with will call you daily to assess your symptoms and will confirm with you when you are no longer required to self-isolate. We ask that you monitor your temperature and symptoms each day, record and report this information to the nurse that calls you. If you are taking a fever reducing medication, then remember to take your temperature at least 4 hours after the last dose. If your symptoms worsen or you have questions before the next phone call from us, you can contact our client information line at 905-123-4567, extension 5555. If it is an emergency and you require immediate medical attention, such as if you're having severe difficulty breathing, where you are struggling with each breath, or speaking in single words, severe chest pain, having a very hard time waking up, feeling confused, or you're losing consciousness, then immediately call 911 or have a family member call on your behalf. You are required to let all healthcare providers know about being diagnosed with COVID-19 when seeking care to ensure appropriate measures are taken. Do you have any questions for me, Alice? I know that was a lot of information.
No, I think I'm okay for now, and thank you, and I really appreciate all of your information.
You are welcome, Alice. I may need to call you back to gather additional information, so please remain reachable at this phone number for future calls from the health department. I also encourage you to stay connected with your family and friends at this time by phone, texting, or through video conference calls. Don't hesitate to call us with any questions or concerns, and know that we can also help to connect you with appropriate community resources to meet your needs. I hope your cough improves and that you have a full recovery soon. Take care.
Thank you, Susan, and you have a good day too.
So thank you everyone for your participation today, and we hope that was helpful for your learning, and we do welcome you to share this with your students and other colleagues that may benefit from this video.